As a reminder, when you get vaccinated, let's remember what vaccines do. Vaccines are a tool we use to teach your immune system what to respond to. So your immune system knows what is you, and as it develops, it then starts recognizing what is not you. So your immune system will respond anytime something that is not you comes into your body. This is why we have issues with organ transplantation and such like that, right? So the immune system has to be controlled for that. I often use, this is just a very simplified example, but if you were to say, a virus has its DNA or RNA on the inside, and then it has a protein shell on the outside, it's kind of like a candy-covered chocolate candy that we get, right? Like a Skittles or an M&Ms or whatever. So when we make vaccines, one way of making them is that they give you the virus that has been deactivated so that it can't make you sick. But you still get it, and so your immune system recognizes, well, that's not supposed to be here. It learns it and develops a memory. Well, while it's learning it, it's responding to it. It's reacting to it. So you're going to get a little bit of fever. You're going to get some body aches. You're going to feel a little bit crummy. Not nearly as bad as if you had the real illness, but your immune system is going to respond to the vaccine, and you're going to get some mild symptoms. So some vaccines, like the measles vaccine, is an inactivated virus. There are other vaccines where what they basically do is they take the M&Ms, if you will, smash them all up, melt away the chocolate, which is the part that would make you sick. They leave the protein shell, the candy-coated shell, and that's what's in the vaccine. Again, your immune system then sees the shell of the virus, if you will, recognizes that's not supposed to be here, so that next time it sees in the future, it responds to it. Either way, the virus is your immune system is responding to what it sees on the outside of the virus before it has a chance to start getting into your cells and start causing trouble. There's probably more of an answer than you wanted, but I think people need to understand that the bottom line of that is when you get a vaccination, whether it be the flu shot or measles or pretty much any vaccination, if you develop a little bit of fever and achiness over the next couple of days, that's a good thing, because that says that your immune system is recognizing, reacting, responding, and building up its defenses. So yeah, you may feel a little bit crummy for a couple of days, but that's far better than that, getting the actual illness where you're going to get really, really sick, right? So.
I had heard yesterday that we have reported possibly two cases are being looked into, the measles cases here in Houston. Is that correct?
So what's happened is let me tell you about it. So yesterday, we the Houston Health Department, had a town hall, if you will, with about almost 500 clinicians across the region to tell them what to look out for, and if you get a case, what you can do and how you get things tested and so on, and how you report it and all that. So these two cases were from before then, but these are two situations where clinicians thought that somebody might have it. And quite honestly, the signs and the symptoms and the stories are not really obvious for measles, but they wanted to get them tested. We have two samples in the lab, and we won't know until they come back. That having been said, I want to support the clinicians who are going the extra yard, because they know that the stories and the signs and symptoms of these two cases aren't clearly measles, but they're going the extra yard and making sure, right? And so I want to applaud them. I want to support them in doing that. And as we go on and as time goes on, we are likely to see more of this, where clinicians will be submitting samples because it's going to fall into one of three buckets. I'm not really sure at all, but I want to be sure. Geez, this looks like maybe, and I need to find out, or wow, this really looks like it and I need confirmation, right? So right now, these two cases are kind of over here where it doesn't sound like it, but they want to be sure. But we will get, as time goes on, I anticipate that we're going to get cases that'll fit into, and I just made up those three buckets, so bear with me, right? But you can imagine that that's sort of the spectrum of level of concern that clinicians may have. Now, when I was a kid, and for example, in the late 80s, there was a pretty significant outbreak in Los Angeles. And they got to the point where they didn't even do the testing. They just could recognize it clinically. They recognized the person had it. I hope we don't get there, right? But that's possible, too.
Now, I know most of the cases are coming out of West Texas right now. However, with the Houston rodeo, kicking off, tons of
Yep.
are going to be descending upon Houston. In addition, spring break is just around the corner. How concerned is the health department that cases are going to start spiking possibly here in the Houston area as well?
You're talking about how concerned are we?
Yes, that cases will start to spike with all these people coming to the city.
Yeah. Well, we're very concerned. Obviously, we're having clinics. I told you, we had this town hall with all the clinicians. We're meeting with you. So we're ramping up in preparation in the event that something should occur. But I think that an important part of your question is today, I don't think people need to change anything that they're doing. I don't think they need to change any of their plans. I think that you need to, if you're, certainly if you're vaccinated, you really probably don't need to worry about changing anything at all. Now, if you know you're not vaccinated, you might want to consider whether or not you want to go into a crowded environment, whether it be, a movie theater, a sporting event, a concert, whatever. Now, today here in Harris County, we don't know that we have any cases, right? But a couple weeks from now or a month from now, should we wind up like where Grimes County is, where there's a fair number of cases, then you might want it. But today, I wouldn't worry. I wouldn't change anything I'm doing today, whether I'm vaccinated or not. Except if I'm not vaccinated, and 2 weeks from now I want to go do something, I would go get vaccinated today. Remember, here's the other important thing. It takes about 2 weeks between when you get the vaccine and when it really has, educated your immune system to be up and ready to go. So if you've got something coming up that you want to go to, a large gathering, and you either, you're not vaccinated or you're concerned, I would jump on that now. That's one of the reasons we have these clinics right away. We don't have anything, we don't, like I said, we don't think we got two samples in the lab, but we don't know that we have any cases here. But we're leaning forward so that people who want to get vaccinated, so they can do whatever they want 2 weeks from now, they will have the opportunity to get vaccinated today.
How many more of these free vaccination clinics does the health department plan on hosting?
Yeah, I think that is it's in development. You want to take that?
Well, actually, we are planning to reach out to kind of our most vulnerable populations, the schools, things like that. I don't have an exact number for you, but just to keep in mind, we have 3 health centers here in the Houston Health Department from the Houston Health Department, but also our Harris County partners have some clinics as well that are open Monday through Friday, generally between 8 to 6 p.m. on Mondays and then 8 to 5 Tuesday through Friday. So their availability throughout the week, regardless of whether we have kind of the pop-up clinics.
And is that still based on eligibility as well? Or will it cost people anything? Or will it be free if they were to walk into one of these clinics?
Yeah, we do have a sliding scale, but actually if they have questions, they can come into our centers, we can let them know, or even call our main number. And then if you have insurance, like a private insurance, you can go to your provider, your pediatrician, and ask for the vaccine there. They traditionally have this vaccine. It's a routine vaccine. It's regular for all children, as Dr. Persse had said, so readily available in Houston.
Dr. Persse, do you have any final thoughts or a message you'd like to share with the community?
I think we kind of hit on it. The bottom line is, I don't think that, this is absolutely not the time for anybody to panic or, overreact. This is the time for folks who think that they are not vaccinated or know that they're not vaccinated to go ahead and get vaccinated. It takes about 2 weeks between when you get vaccinated before your immune system is really ready to go. So now is the time, before we have any cases here in the Houston area, now is the time to go ahead and either find out if you've got immunity or get vaccinated, one of the two. And I think, and again, for your children, right, the same thing, right? So, you good?
Everybody good?
Okay, let me just one last thing, and I say this, and I know people always say this, but I really want to thank you guys in the media, right? This is an important message to get out. People are scared, and I want to thank you for being here today and getting the message out with a level tone, and not unnecessarily exciting people, but educating them so they can make a decision. And some people, and I'm going to go there a little bit. Some people, vaccines have become a little bit politicized, and I don't want to get into that. But I do want people to have the information so that they can make what they believe is the right decision for their families. So thank you for being here to help us get the message out. It is really important. Our most important tool in public health is public messaging. So thank you.
Sorry, Dr. Persse. John, he said that there are some talks that people think that if they got the COVID-19 shot, somehow they're protected.
Oh, yeah, no. Completely different viruses. Yeah, completely different families of viruses. Yeah, unfortunately, the COVID-19 does not cover you for measles. That would be nice, but it's not the case.